Today we are going to talk about a very important question, and it's very confusing, not just for patients, but also for providers. The question is, when you should take levodopa? Should you take the levodopa with meals or without? When I say levodopa, I'm talking about Sinemet, Rytary, or the new medication Crexont. My name is Dr. Zayas. I'm a neurologist specializing in movement disorders. I will tell you what is the problem. The problem is that levodopa, it doesn't matter what type of formulation, compete with proteins. When I say proteins, I mean chicken, egg, steak, all these things that have high levels of protein. So the levodopa compete with any type of protein at the level of the brain and intestine. So you might have technically problem with absorption. Some patients worse than others. I will tell you that people, younger patients. So for example, if you are a 30 years old patient with Parkinson and your dad has had Parkinson or has Parkinson, you might be more predisposed to this problem. But there is no way to predict which patient will be more susceptible or not, except these problems tend to be more pronounced in patients with a strong family history and younger patients. So it might be related with that gene that we are not sure about that. So typically people take one tablet of Sinemet, carbidopa levodopa, the regular one, the yellow pill, 25/100 3 times a day. During the beginning of the disease, that might be enough, and you don't need to separate. You don't need to separate. However, after 5 years or so, everything is dependent, but after 5 years, this process of absorption, storage, and release of dopamine is not going to work in the same way. So, which means that you might be more predisposed to have this problem, and you need to separate the pills, the levodopa, from your meals, especially if you are eating egg or tuna or chicken, anything with proteins, because it might compete and you are not going to absorb levodopa enough. That's the main problem. Let me summarize. During the beginning of your disease, in other words, during the first 5 years, don't worry about this interaction. You eat and you take your pill after, okay? Don't worry about that. Now, after 5 years or so, or it doesn't matter, but sometimes it's more than 5 years, sometimes it's 10 years, every patient is different. But when you start having fluctuation, which means that you are wearing off, or you are having other motor issues related with the levodopa, then this is when you start separating the pill, the levodopa, from meals, especially meals with proteins. How do you do that? Well, you can take your pill and wait 30 minutes or 60 minutes, so half hour or 1 hour, and then you eat. Or you can eat and wait approximately 1.5 hours or 2 hours after taking your pills. Okay? So this is kind of confusing, since the pharmacist and other providers will tell you different things, but believe me, this is the right answer. If you like this video, don't forget to subscribe to my channel. See you soon.